I'm Dr. Halliday from Finger Lakes Medical Aesthetics, and we have Maureen Green here. She's just 10 days post-op from the timeless lift that she was unhappy with it, how her face had aged. She had some jowling and she had some loose skin in the neck, and she wanted something done about it. And that most lifts require an anesthesiologist and some kind of certified hospital OR setting. This lift was designed to be able to do in an outpatient office setting with local anesthesia. I think the big difference between this and is actually how it's done and how we administer the local anesthesia, where it's a whole process where we put on a topical numbing. We take a small little 30 gauge needle to start the numbing. So it's really pretty much a painless procedure. It's not just a mini lift, it's a full lift. And one of the things we do a deep dissection in the neck. The muscle that we suspend, we go into what we call the deep plane, which allows us to really mobilize the neck and the jowl muscle. You can lift that muscle up as one complete unit. We actually divide that muscle. So there's two elements to elevation. There's the upper plane, which gets lifted in this direction. And then because we split that muscle, this plane gets lifted in that direction. And it just gives a really smooth, normal looking result. The surgery took about, 2 hours.
Didn't hurt.
Didn't hurt.
It didn't hurt at all. I didn't feel anything.
We actually play music. We can actually talk to her while it's going on. And she was able to go home and sleep in her own bed that night. And the next day we saw her. We do a dressing change. There's a little drain we take out. And then next time we saw her was really today, which was 10 days ago. And look how great she looks. Recovery time is significantly different. Anytime you have a procedure under anesthesia, whether it's especially with a general or a heavy sedation, there's a lot more bleeding. We say the patients get more vasodilatation and a lot more swelling, and the recovery is longer. So most people can get back to work in the range of 7 to 10 days. Even the next day, they could do remote stuff from home. What we see when we do it the way we do it, there's very little bruising. Anyone that's, unhappy about their appearance regarding how they've aged, and usually they see the mid face, the area of the jowl around the jawline, and the neck that's sagging. The age range is really 40 to 80. I'd say the most common age that someone has this is probably 58 to 60. Still, women by far have more, age-related surgeries. Women are more used to changing their appearance with makeup and hairstyles, where men are more reluctant to do that. Men certainly are good candidates for it, and we've done plenty of men, but it's probably only about 10% of the population. But I think that number is going to, grow over the next, 10 to 20 years.
You come in here and the staff is so welcoming, so warm, so nurturing. Dr. Halliday, so skilled. So there is nothing to be afraid of. Don't hesitate. And you'll just be so glad that you did it.
Dr. Halliday is the only one I trust with my face. You can trust him too.
Call for an appointment today.